When a patient complicates into cardiac failure, which is evaluated by clinical features, then we have to take, firstly, general therapeutic measures. These therapeutic measures are number 1, diuretics, number 2, AC inhibitors, number 3, beta adrenergic blockers, number 4, digitalis, number 5, antiarrhythmic therapy. In severe form of heart failure, selection of diuretics done taking into account abnormalities of serum electrolytes, resultant hypovolemia also should be taken into consideration. For mild and moderate heart failure, choice of diuretic is loop diuretics. As example, furosemide, bumetanide, etc. Thiazide enhance seriously the danger of digitalis intoxication. It causes hypertonic urine, consequently dilutional hyponatremia, then hypokalemic alkalosis, which enhance danger of digitalis intoxication. The powerful diuretics are useful in all forms of heart failure, particularly in patients with otherwise refractory heart failure and pulmonary edema. They are effective in patients with hypoalbuminemia, hyponatremia, hypochloremia, hypokalemia, and with reduction in glomerular filtration rate, and to produce diuresis in patients in whom thiazide diuretics and aldosterone antagonists along in combination are ineffective. In patients with refractory heart failure, the action of loop diuretics may be potentiated by intravenous administration and by addition of other diuretics, that is thiazide, metazolone, osmotic diuretics, and the potassium-sparing diuretics, spironolactone, trimetrin, and amiloride. Second drug of choice is ACE inhibitors. It acts for myocardial infarction and ventricular regurgitation, but it is contraindicated in hypotension. It should be started just after myocardial infarction without cardiac failure to reduce long-term mortality and enhance exercise performance. Its effects and affects is hemodynamic action, that is afterload and preload. It reduces the impedance of left ventricular ejection and stroke volume. In this way, it increases cardiac output and decreases pulmonary wedge pressure. In patients in whom ACE inhibitors is contraindicated, as example, cough, angionephrotic edema, leukopenia, angiotensin II receptor antagonist, that is losartan, is given. Next medicine in cardiac failure is beta adrenoceptor blockers. Is not indicated in heart failure if patient is unstable, heart failure shortly after myocardial infarction, there is diastolic failure, and NYH in class 4. Its abrupt administration should be avoided. Its example is metoprolol, carvedilol, bisoprolol, etc. Some more things about the treatment of cardiac failure in next video. Sorry.